Hi, this is session 9 and we'll be looking at some practical clinical pointers when dealing with GI conditions. The first thing that we'll be looking at is nausea and vomiting. Now, nausea and vomiting could be it could be a symptom of a lot of conditions. It could be something like acute gastritis, it could be peptic ulcers, it could be food intolerances, or it could also be, pregnancy related, morning sickness, or it could be, pain, nausea due to hormonal irregularities related to menses, or it could also be because of, equilibrium problems like, vertigo or motion sickness. Even that could lead to nausea or vomiting. Now, one thing good with homeopathy is we are not actually diagnosing the condition as to what it is. For us, what is important is the symptom. So, the case taking should involve factors like, if you've got nausea or vomiting, what is it that you feel, or how many times are you vomiting, what are you vomiting, is it only water or is it undigested food, and also the modalities, when is it that you feel the nausea, or how long after eating do you vomit, or is it only a sensation of nausea and there's no vomiting accompanying it. So it's all these symptoms that are very important in homeopathy rather than the diagnostic factor. So if you have a patient who's got nausea and vomiting, one of the hints or the way I would deal with it, which Morrison also seems to advise people, is to give the remedy chosen based on the law of similars, but leave the administration, like the number of times you're advising the patient to take it, to be dependent on the vomiting, the episodes of vomiting, or maybe even diarrhea that they have. So this is something which I would do in my clinic too. I would give them the medicine and say, okay, take one dose now, and after every episode of vomiting or diarrhea, take another dose. So maybe initially they would need the medicine much more, and once the effect has started or the medicine has started working, then the number of times they need the medicine will become even less. But the only factor that you've got to keep in mind is you do not repeat the medicine too often. And Morrison says do not repeat the medicine more than 6 times per day. So if you've repeated it 6 times and there's no effect whatsoever, that means you probably have chosen the wrong medicine. So it's better not to continue that and think of changing anything. Now, remember that vomiting, one of the red line symptoms is that persistent vomiting or projectile vomiting may be indicative of some serious gastrointestinal or neurological problems, which is a case for referral. Now, homeopathic treatment is also able to reduce the nausea due to chemotherapy. Okay, and Morrison says that homeopathic treatment can reduce the nausea by no more than 50% during the day of the treatment. One thing to remember in any case where there is a loss of body fluids, for example nausea or vomiting, is rehydration. Dehydration is very common, and especially so when it is children and really old or people of low vitality. So rehydration is a must. Now, rehydration does not mean drinking overly sweet drinks like Gatorade or which has got a lot of sugar. Now when there is a lot of sugar in it contributes to dehydration more than rehydrating. Yeah, and this sweetness, excessive sweetness, may also slow the gastric emptying. Okay. Now, in response to homeopathic treatment, the patient may become thirsty, and this is a good sign. So, advise the patient to start little by little. Don't, gulp the whole thing. Just start with 1 or 2 sips every 15 minutes until they are able to retain the fluid. But if they say that they want to drink, it's a good sign. So, continue with the medicine. Now, another common condition that we see in clinic is colic. Now, colic in babies is very common condition. Now, in this, case taking in babies, in children is quite different, because here observation is all important. Now, with the colic, what is the baby doing? What is the infant doing? Are they crunching up or are they stretching back? The objective symptoms is what is very important, and depending on the movements, their facial expressions, and what they're doing during that colic decides what the medicine is. Yeah, and another area of questioning that is important in infants, in conditions or relating to infants, is the family history. Is there a susceptibility to that in their family history? And also, it's quite important to find out the mother's emotional and physical health during the duration of the pregnancy. And that could also play a role in the symptom picture that is presented by the infant. If there are time modalities, consider that. Okay, that would be really, really useful in selecting the medicine. Now, stomach pain. Now, stomach pain, like I told you, is anywhere below the diaphragm, till the end of the abdomen, is considered stomach by the patient. So you've got to be very careful as to the location. Make the patient point it out to you where exactly is the pain. Now, stomach pain again may be due to a lot of reasons. It could be just emotional, mental, emotional. A child might come and say, I've got a stomach pain, when they don't want to go to school. It could also be stomach pain maybe due to reflux. It could be also something as a side effect of anti-inflammatory medications. So we need to actually know. I know that we don't need to diagnose the condition, and it's only the symptoms that are important in homeopathy. But if it is, it's good to take a complete case taking, because once you know that the etiology of the condition, like if the stomach pain is because of the anti-inflammatory medications, then you can base your case management around it. If it is, the pain is because of reflux, you could again advise the patient as to what foods to avoid and what to do. So the etiology is quite important in these situations. Any stomach pain which is not resolved within 24 hours after start of homeopathic treatment, bring the patient in to the clinic. You need to do a physical examination. Don't continue treatment over the phone or by Skype, because there might be symptoms that you miss out when you just do a phone consultation. For example, if they have cracks at the corner of the mouth, that's often a sign of peptic ulcer disease. And the patient may not, consider telling you that. That's something which you as a practitioner could pick up. Now, in more serious conditions like Crohn's disease and ulcerative colitis, it's preferable to have more than one health professional helping that patient. So a multimodality approach is preferred. Now, in these conditions like Crohn's disease and ulcerative colitis, etc., you're looking at potency choice is usually going to be a low potency or Q potencies. And you're probably going to give daily doses. And in my experience of Crohn's disease, there is a huge mental, emotional factor involved to it. Yeah? And symptoms like bleeding with the stools or, is a more common symptom. In conditions involving chronic diarrhea, like IBS or food sensitivities or even food intolerances. Now, in these, you have to give practical advice. Yeah, so these are your obstacles to cure. So management of diet over here becomes very important.